Hello YouTube, welcome to Dr. Vibes, a learning point. In this video, we will see how to manage a patient of septic shock. So you know that management means investigation and treatment. So patient with septic shock has come to you, what will you do? First of all, you will do the routine blood tests, which involves the hemoglobin percentage, the complete blood count, the platelet count. You have the serum bilirubin, serum creatinine, serum urea, serum electrolytes, that is sodium and potassium. Your fasting blood sugar, you have postprandial blood sugar, and you have HB1AC. Along with that, as this is a case of septic shock, sepsis means infection and systemic inflammatory response syndrome, so you have serum CRP as well. And you will do serum procalcitonin. After you have done all these tests, all these blood tests, you have to identify the source of infection. For that, you have to do a full external body examination to look for any obvious infection, like there can be diabetic foot infections or there can be thrombophlebitis. After you have identified the source of infection by an external look, you have to do USG, whole abdomen, USG thorax, and obviously chest X-ray in the posterior anterior view. Now, the second step is monitoring of some important parameters. Like you have to monitor the vitals, the blood pressure, the temperature, the respiratory rate, the SpO2 and the pulse rate. Second, the parameter that you have to monitor is CBG charting. Third is the intake output monitoring. How much water the person is taking and what is the urine output. Fourth, central venous pressure monitoring. So this is all about the management, the blood tests, identifying the source of infection and monitoring of certain parameters. Now you have to treat the patient. So care must be taken to initiate the following within the first hour after presentation of a patient with septic shock. Because septic shock is an emergency, so you have to take care of certain things in the first hour. First of all, you have to measure the serum lactate. In case the serum lactate is more than 2 millimole per liter, re-measuring is necessary. You have to re-measure the serum lactate. Now, I may ask you why serum lactate goes high? Because in septic shock, as this is a case of shock, that means patient is in hypoxia, the cells will go to anaerobic metabolism. Second, you have to administer the antibiotics to the patient. Third, you will have to do the rapid administration of crystalloids at the rate of 30 ml per kg for the patients having hypertension. The fourth step that you need to do is use of vasopressors if the patient is hypertensive. During or after the fluid administration to the patient, the mean arterial pressure should go above 65 mmHg. Fifth, initiate broad spectrum empirical antibiotics and later on modify the result or modify your antibiotics based on the blood culture report. Sixth, if the hemoglobin percentage goes below 7 milligram percentage, you have to do transfusion. Now, there is a complete video on the indications of blood transfusion. You must go and watch that. After you've done all these 6 steps, goal-directed therapy is needed. What are your specific goals? That my mean arterial pressure of the patient should go above 65 mmHg. Central venous pressure should be 8 to 12 mmHg. Hematocrit should be more than 30%. And the blood glucose should be 80 to 110 milligram per dl. So let me just summarize what are the points that you should take care of. The antibiotics, the crystalloids, the blood transfusion, the vital parameters, and then there is the goal-directed therapy that you should look for in patient of septic shock. Lastly, monitor the urine output. It should be 0.5 to 1 ml per kg per hour, and this can be achieved via intensive insulin therapy.